Welcome to the PubMed Clinical Queries tutorial. Before we begin our search, let's review our PICO question. For today's search, we'll be examining an adult patient that happens to be male, they're 68 years old, with diastolic heart failure. For our intervention, we're examining aerobic exercise versus no aerobic exercise. And in terms of the outcome, we're seeing if this will improve quality of life and reduce hospital admissions or readmissions related to systolic heart failure. This is PubMed's basic search screen. For this particular search, we'll be utilizing the clinical queries style search. This will allow PubMed to only return items of a case study level and above in terms of level of evidence. So I'll click on this now, and this will bring us into the clinical queries style search. PubMed allows you to type in natural language or keywords, and in the majority of cases can automatically match those terms with the structured subject headings that are within the system. So we can enter our search here. We can still use commands like and or to assist PubMed in putting together our various search terms. Let's try that now. So in our case today, we're dealing with diastolic heart failure, and I'm going to place an and here. I do like to use caps when I'm using a command like and or. It makes it easy to see in the search line versus my search terms. I'm also going to put in the term exercise. We'll throw in another and in this case, quality of life. And the other outcome we're interested in would be hospital admission or hospital readmission. So I'm going to use some ors here. To make sure that the ors happen first, which would be very important, I'm going to surround this or phrase with parentheses. Let's see what happens when I hit the search button here. So we'll now search across PubMed, and you can see this automatically searches in the therapy category. We could change that if we want this to have more of an etiological feel. Just another way we could update these results slightly depending on how we're viewing the question. In terms of scope, there is a broad or sensitive search and a narrow or specific search available. We'll stay broad at this point. Please notice that our search results are broken up into three categories. We won't be dealing with the medical genetics category today, but there is a column for systematic reviews and one for clinical study categories. You might see duplicate results between systematic reviews and the clinical studies. However, in some cases, I found that systematic reviews aren't always included in the clinical study category, so I always double check that. That can be very, very useful. But in our case today, I'm going to scroll down, and to see these 105 results, I'll click this See All link here. That will bring those results on screen. And at this point, we could add some further limits. The Show Additional Filters link is very useful. I've selected languages and ages to appear. Those were some additional things that you have to add. Once you hit Show, they will appear in that left-hand column. So in our case today, I'll adjust our publication date to the recent 5 years. That impacts our search greatly. For language, I'll select English, and we also want a particular age group. I'm going to choose 65 plus. At this point, it would be nice to examine these results, but I would recommend making a small change here. To do so, I'm going to go to the display settings. I'm going to place this in abstract mode. And I usually like having a little more rather than less on the page, so I don't have to keep going to the next screen. So I'll add 50 items per page, and I'll apply this now. In abstract mode, you will get your abstracts directly on screen, and you'll also see the Drexel Get It buttons available underneath each citation and/or abstract. If you're looking for your search details, I recommend going to the Advanced screen. On the Advanced screen, you can see various searches that you've done along the way. It would be very easy to copy and paste this information from this particular display. This concludes the PubMed Clinical Queries video tutorial. Thank you.